Welcome to Tea Time with Dr. K, where we share stories that inspire transformation, celebrate victories, and dive deep into the journey of health and wellness. Grab your tea and let's build a better you, one conversation at a time. Hi, everyone. This is Dr. Cross, and I have a very special guest here today, the one and only Brandi. Thank you for being on our podcast, Brandi.
Thank you for having me. Happy to be here.
I know. And she's been a patient of mine for a few years, right?
Yeah, like 2
years.
2.5.
2.5 years. And so she's going to start about talking about her journey with us. First, tell me, how did you find out about Melanie Small's practice?
So I first found out about you. Actually, I came in for an implant. I lived nearby. I saw you.
Yeah.
So that's how I discovered you.
Yeah.
And from there, that's how we got started.
And you know, I remember the very first time you came in, you were talking about implants, but I also noticed that you have a lot of wear. Your teeth have worn down significantly. Like I'm talking about 4 or 5 millimeters of enamel loss. And I think my assistant went through a questionnaire with you. Or how was that experience? You know, finding out about what's really going on and what we can actually do to help you.
Yes. So, I came in for an implant. We talked about
the implant,
and also, yes, my journey with TMJ my whole life. So through that questionnaire, we talked about TMJ, the wear, the bite, the grinding, the clenching, all the things.
The headaches? Did you have headaches?
I did have headaches, things that I didn't maybe realize were connected to TMJ, getting up in the middle of the night. And so that was surprising and informative as well. So
you didn't have to take any sleep tests too, right?
I did take a sleep
and you had a sleep apnea as well.
I did.
So here's what happened. She came in, again, as I mentioned, she came for implants. And when I look at somebody's mouth, I at least like to inform them what else is going on. And it's the patient's decision what they want to do about that information. But she was very proactive. And when I mentioned, yes, I can place an implant here for you. But at the same time, I also noticed that you have your TMJ issue, temporomandibular joint disorder, meaning that she has pain in her jaw and, you know, headaches and a lot of wear in her teeth. And I recommended, I said, you know, it would be great if you can take a sleep test because we know where there's sleep upwards test in the office and you scored high. So therefore, we sent her for a sleep apnea test, and you happen to have sleep apnea, correct?
Yeah.
Yeah.
And to my surprise.
To her surprise. Because, you know, how was your sleep at night?
It was not great.
So tell me about it a little bit.
And also because I am single and slept alone, I think that I didn't realize, right?
How it was impacting
how it was impacting me, right? But I did not sleep well. I would wake up tired. I would get up often in the middle of the night.
Go to the restroom.
Yeah. But just wake up feeling exhausted and not well rested.
Wow.
Yeah.
So the reason she was waking up, you guys, so there's 2 types of sleep, you know, I would say sleep disorder. One is a sleep apnea, which you stop breathing for 10 seconds or more, so many episodes per hour. And another is sleep breathing disorder, where your oxygen level drops to, you know, from 98% to 91%. And according to a recent study from ADA, is that if your oxygen level drops to 91%, I said ADA. It's actually a recent study from Harvard University that you actually are considered a sleep breathing disorder patient. And she was, did you have an episode that is stop breathing, or I don't remember exactly the numbers, or the oxygen level drop?
Oxygen levels dropped.
She's smart. She remembers exactly her test. So her oxygen level drops. So that, you know, those patients actually get hardly diagnosed properly because then they don't stop breathing for 10 seconds or more. But guess what? Their oxygen level is dropping. And then their body is waking them up. Hey, wake up. I don't want you to have a heart attack. I don't want you to have a stroke. Wake up, wake up, wake up. And that's what happened. Throughout the night, you were waking up, right?
Yeah.
Several
times. 4 or 5 times.
Yeah. And then she would end up going to the restroom because her diuretic hormones were causing her to have this fight or flight response, making you to position that, hey, I don't want you to go through any of heart attack or stroke, wake up so you can actually breathe, go to the restroom. And that's what was happening to her. And so I told her that if we go through expansion process, we can only cure, the sleep breathing disorder, but we can also address the TMJ as well. So tell me about that process. And I know you lost, 30 pounds too along the way. So
Yeah.
tell me how that worked for you.
Yeah. And two, I mean, like I had gone through my whole life with TMJ problems and had seen many dentists and doctors. And
you happen to be the one that came to see me and be like,
that's right. And I thought that, oh my gosh, there is no hope, but like, I mean.
You had seen other TMJ dentists?
Yeah. And I thought.
Interesting.
I had, and there was never conversations about like sleep or expansion.
What did they even tell you? Like, what did they even say? Like,
I went through orthodontics, and I've done.
She'd gone through orthodontics, but her jaw was so like restricted, and everything was tucked in, right?
Yes.
And interesting enough, guys, she went through orthodontics, but her jaw very, very small. I will ask Kevin, my videographer, to put a before and after, before we started treatment and after a year into treatment and after expansion, what her jaw looked like, her expansion in the jaw. Mm-hmm. So tell me more.
Yeah. And so I, just after all, I mean, my whole life, even as like a small kid, and I thought, well, I'm still clenching, I'm still grinding, like I still have headaches. And I guess there's no hope. Like I'll just live with this for the rest of my life. Right. And so in my 30s, like coming in for an implant, stumbled on like a life-changing like experience. Yeah. Right. And so so came in and so for the TMJ, like going through this whole process, like we started with myofunctional therapy and expansion and at the same time, and Solea sleep therapy.
Yes.
And it was a lot and at once.
Yes. Because I go in full force, right?
Yes.
Yeah, it's no breaks on anything. If I want to treat someone, we're going to go in full force. We're going to get it correct the first time.
Yes. It was a commitment.
Yes.
Absolutely.
Absolutely.
Commitment. Yeah.
And I always tell you from the beginning, I'm like, this is a commitment.
This is what you're getting into?
Yeah. And there's money, I mean, a lot of monetary investment, but also time.
Yeah.
Because I tell them, like, listen, this is a lot of monetary investment, but at the same time, if you don't invest the time, it's not going to go as well, right? And I never start any treatment with anyone unless they fully understand that there's a huge commitment on their end. I'm only 50% of the progress. The other 50% is you, right?
Yeah.
It's exactly what I talked about.
That's exactly right.
Yeah.
And I would say within, just a couple of months, I was sleeping better.
Yeah.
Sleeping almost through the night. Not completely through the night. I am now, but
she's now, within 2 months, she said almost through the night. Yeah. And after probably like how many months you actually completely sleep through the night?
Gosh.
5, 6 months?
Yeah, probably like 6 months through the night.
Yeah.
But after even just a couple of months, I was only getting up like maybe once or twice. So
and then after 5
or 6 months, encouraging improvement like early on. Yeah. And even like headaches started to improve and
go away, right?
Yeah.
So how many headaches would you have throughout the week or throughout the day or whatever?
I wouldn't say that they were maybe daily, but throughout the week, probably like 3 or 4 headaches a week.
So you think about 3-4 headaches a week, you're talking about 12 a month.
Yeah.
12 to 16 a month. That's a lot of headache to have per year.
Yeah.
Yeah.
And it interferes like with your work and your parenting and your life. So, yeah.
And so your life improves.
It does.
And not only that, you start losing weight too.
Yeah.
Talk about that.
Yeah. So I did. I lost about 30 pounds. Yeah.
We were matching at the same time.
We have.
She came in, I'm like, my gosh, she's losing weight. She goes, yeah. And here's what happens. Whenever you're sleeping better, you're going to be able to digest better and oxygenate better. So that means the blood flow of the oxygen is going to go to your cells, and it's going to help with mitochondria and ATP production and cells repair and all that stuff. And she was getting that through better night's sleep, myofunctional therapy, which helps her nasally breathe rather than mouth breathing. And also the proper jaw position, because her appliance, the way we made the Vivos Appliance, is to help her not only expand, but also start healing the jaw joints as well. along with, you also did laser treatment, right?
Yes, I did.
How did that help you? Like, and I know you had some jaw pain, and when you started doing laser, how did that laser therapy help you along the way?
Yeah, that significantly helped with the pain.
Yeah.
And taking away the pain, improving the pain.
Yeah.
So,
Even within the first one session?
oh, like right away.
Yeah.
Yeah, kind of immediately.
Yeah.
So
that's really awesome.
yeah. And I would say too, like the better night's sleep helped with just having more energy.
Yeah.
And like I would never want to work out, never want to like get into the gym there, even at home, like going out for walks or runs or whatever.
Yeah.
So just being able to have a better night's rest, having more energy to like feel motivated to
go actually do the run.
Go do the run or do the
exercise
that I needed to do.
Yeah.
Yeah.
Isn't it amazing how it works,
Yeah, it's like a domino effect.
Domino effect. That's right.
Yeah.
And then you start eating healthier.
Yeah.
You're like, okay, now that I'm losing weight, I might as well pay attention to how much protein I'm taking. And
that's right.
Because you don't want to, regress backward. You want to move forward,
Yeah.
So, so the entire process for you was how long? About a year, right?
A little more than a year, I think.
A year and 2 months.
Yes.
A year and 2 months. So you went through Vivos expansion, myofunctional therapy, which, by the way, can you tell me a little bit about myofunctional therapy and what you had to do for it?
Yeah.
She's like, here's Brandi. She did a lot of work, but then it's out of sight, out of mind. I'm good, So let me remind her, myofunctional therapy was like, therapeutic exercises that you had to do 3 times a day.
Yes.
Yes. How did that initially improve with your sleeping and your breathing?
Yes. And also my bite too. Well, she's completely different today than it was a year ago.
Yeah.
So yes, those were exercises I did 3 times a day, and pretty like quickly, I mean, within like, I would say weeks, like it would improved my breathing, my sleeping, and I think just as a result of like the positioning of my mouth, my jaw.
Yes.
And
that helps a lot.
Yeah. And sometimes they felt a little silly.
Yes, it does feel silly when you do those therapeutic exercises. Yeah. But at the same time, it helps a lot.
It does help a lot. Yeah. And I mean, there are things that you can do, right? Sitting at your desk or whatever.
Exactly. When you're at work, you're driving, and you can do the exercises too.
Yeah. So they're
because you become pro at it.
You do.
Yeah,
because you're doing it all the time.
Yes, exactly. Yeah. And it's like it's second nature. It comes just naturally.
Yes.
Yeah. Especially the tongue position.
Even now, I find myself doing some of it sometimes.
Yeah, because you don't want to relapse.
Right. Yeah.
And the reason we do those exercises for about a year, because we want to create a new neuronal pattern in the brain, so that you have this habit of putting the tongue in the correct tongue position, correct swallowing pattern, correct breathing.
Yeah.
But as a result of her, for years, mouth breathing, her soft palate had dropped down. So we did Solea soft palate lift.
Yeah.
Right. How did you notice? Did you notice a difference right away when I actually did the procedure?
The Solea. Yeah. And we did that like, what, 3
times? You did 4 times?
Yeah. And I did like, and all of this was kind of around the same time.
Yeah.
Right. Yeah. Like I said, pretty immediately I noticed a change in my sleep.
Right.
And within just a couple of months, like I was sleeping almost through the night. Like it was a pretty drastic.
You can notice the difference right off.
Yeah.
Right.
Yeah.
So she went through that whole, Vivos expansion with, addressing her TMJ at the same time, healing, myofunctional therapy, Solea soft palate lift. We also did what's called a tongue release, because her tongue was restricted, pushing her like the jaw back, and also anytime she swallowed, there was a lot of tension around the neckline, and which contributed to also her headaches and then jaw soreness and all that stuff. So when I did the tongue release, did you notice a difference in any neck and back and shoulder area? Did you notice there was less tension there?
I think that was more like contributed to the headaches.
Yeah.
And
Yes. So when it got released, you also noticed a difference there.
Right. More in like, I don't know that I noticed a difference really in my sleep, but I definitely noticed a difference in like my headaches.
That's right. Because there was less tension, less pressure. Because you guys, believe it or not, from the tip of the tongue, which is the fascial tissue, all the way to the tip of the toe, there is one fascial tissue, is interconnected. So if it's restricted right here, it's going to posture the head forward. And anytime you posture the head forward, it's going to add 10 pounds to the weight of the neck.
Yeah.
So that is stress, that tension is what's causing also the headache, the, around the neck area, around the muscles of chewing and stuff. So, now she went through the whole, expansion process. We placed the implant for her and all that. It came in the next step. I said, now that we're in a position that we're at, because she has lost teeth in that position, I said, we need to put the loss of teeth back on your teeth, And believe it or not, Brandi wasn't like 100% sure if that's what she wanted to do or like it would give her great results. Remember, I brought you in for a mock-up.
Yeah.
Right. So tell me about that day, that experience, because I said, Brandi, I'm just going to show you the mock-up. And if you love it, we're going to move forward with a full mouth rehab. In my head, I just already knew the answer. She's going to be like blown away. But I said, hey, I'm going to do the mock-up and I'm going to let you see it. And then you make a decision from there. So
Yeah.
Do you remember that day?
I do remember that day.
Tell me about it.
Okay, well, let me go back a little bit because I remember as a kid and a teenager and like growing up, right? Like sitting in the doctor's office and the orthodontist's office being like, one day I'm going to have a great smile, like all those pictures on the wall, right? But then I'm like, lose hope, right? And then I'm like, yeah, actually, I'll probably never have a smile.
Oh my gosh.
Honestly. And then
I never knew that. You told me that part of it.
yeah, I came in for the mock-up and I was like, oh my God, this is the day.
I know. You were impressed.
I was so impressed. Like, I was really shocked. And I was like, and it gets better from here. Because you were like, this is only like 50% good. Like,
Yes.
it just gets better from here.
Yes.
So I was like, oh, actually, I might have like a smile that
smile.
looks that good.
Yeah.
So,
Because you literally, I know when we changed you, when we expanded you, you looked younger.
yeah.
Because, when the teeth are tucked in, then, the facial feature and the zygomatic, bone right here is also tucked in. But when we started expanding her, she got a little cheekbone, it got a little lift. And then when I did the mock-up, which means, well, let me explain to the audience what mock-up is. So when she had lost 2 to 3 millimeters on the top and bottom arch, we wanted to gain that back in porcelain layers. So what I end up doing, I never do the final before a patient can see the blueprint of where we're going, because that's really important to me. I want you to see the final before we even touch your teeth about anything, right? And so what we end up, and by the way, she was an amazing patient like that. Throughout the whole time, she was like perfect. Like seriously, I truly mean that. You were amazing. And I felt like I was just focused on the teeth. And I'm like, once I'm like, are you okay? Are you there? Like she was like, yeah, I'm good, And so, but I remember, sending the digital scan to the lab along with the pictures, and Dr. Tadros and his team at 365 Digital Dentistry Lab, which are amazing. A shout out to them. They did a mock-up of the teeth, like by showing exactly what it will look like before we even get started. So they sent us a putty. Remember the putty? And we put some material in there and we put it against the natural teeth that she has so that she can see the mimic of the final results before we even get started. And I remember that day, like, I gotta show this to my mom, right?
Yeah, I did.
Yeah, and so I had to send her the picture and the photos so she can actually show it to her mom what it looked like. Yeah. And and then the rest is history.
Yeah,
now, look at
right away.
Look at that. Look at a beautiful smile. She got an implant crown, and a full upper and lower porcelain teeth because of the loss of teeth she had. And I would be so excited to show you guys before we started the expansion, during the expansion process, and then after expansion with the full mouth rehab. So Kevin, I can't wait for you to put these three right next to each other. Like number 1 is before we even get started everything. Number 2 is Vivos with expansion of the upper and lower jaw. And number 3 is her full mouth rehab, which I'm so excited to share with everyone because it was such a great transformation. And believe it or not, you guys can tell, right?
Yeah.
I'm going to say this. I feel like she went backward about 10 years.
Oh,
seriously.
You did such a great job. Like it looks,
so
I'm
good.
So happy. Yeah.
And then you go drop to, you start working out, you start losing weight, you start eating healthier, and so that was a journey.
Yeah, it was a journey.
Yeah, but it was a beautiful one.
Yeah.
Definitely.
And equally as impressive to me is like the side by side of like smile with like looking at the images of the
Yes. Oh my gosh, I'm glad you remind me of that, because I'm going to show you guys what her airway looked like before we expanded and what her airway looks like after, because that's really impressive. I'm glad you remember that, because technically, not only we expanded her in the nose area, because when we do expansion, the roof of the mouth is actually floor of the nose, so we got to expand her and on the maxilla area, which again expanded the nose area, but also we brought her forward, which opened up her airway.
Yeah.
Then we lift up the soft palate and did a tongue release. So can I say something about this? So when someone suffers from some sort of sleep breathing disorder, guess what? 4 areas get impacted. I mentioned earlier, we did a lot at the same time. That's true, because I'm not about just fixing and expanding someone or just doing the laser. I'm about what can I do to make you holistically better in the shortest amount of time possible. Without any jaw surgery, guys, no pain, no medication, and no injection except when we had a little bit of a tongue release. Yes, she had the injection for the full mouth rehab, but I'm talking about the first part of the process. When we expanded her, when we did myofunctional therapy, when we did the soft palate lift with laser. By the way, that one was just air, right?
Right.
It was air blowing in the back of the throat.
Right.
How was that procedure?
I mean,
20 minutes?
Simple, easy. Yeah.
20 minutes?
Quick.
Yeah.
Yeah.
It was, the assistants were blowing air, and then we were shooting the laser. I would tell her that if it gets a little warm, just let us know so that we can you know, put a little bit more air so that she doesn't feel the warmth in the back of the throat. So so that's that. And anything else you would like to share with our audience?
I would just say that like this whole team has been like great about making sure you're always comfortable. You always know what to expect.
Thank you.
Yeah. And it's been like a wonderful journey.
Oh, I appreciate that. Thank you so much. And she's a great patient. She takes her teeth real well. She knows she made an investment, and her teeth look like beautiful. Gum health is amazing. And so I'm so happy that you allowed me to take care of you, coming to our practice with one implant, end up curing sleep apnea, curing the TMJ, expanding her airway, and also on top of that, giving her overall better health and function, not only for her teeth, but for her entire body.
Yeah. Thank you.
Thank you.
Yeah.
Appreciate it. So stay tuned, you guys. We have more educational content. I have more podcasts to come. But I appreciate you, Brandi, for coming in today and spending time with us, so our audience can find out a little bit about your journey and get to know that what we can do in our practice.
Yeah, thanks for having me.
Thank you. Stay tuned and have a wonderful rest of your day, guys. Take care.